When we talk about things like climate change or pandemics, there are communities that live on the margins who experience these concerns that we talk about at a much higher level. And so when we think about the impact we want to have as a Stanford community, I hope that we also prioritize social justice. Hi everyone, my name is Zahra Fazal. I'm doing a master's in epidemiology and clinical research at Stanford Medicine. My work is focused on the intersection of social and infectious disease epidemiology, and I was born and raised in Tanzania. So a lot of my interests in global health and the research that I do has been shaped by growing up in Tanzania and witnessing and being part of the healthcare system and learning more about community concerns from neighbors and family members. Albinism is a genetic disorder that results in a lack of melanin production in the human body. In Tanzania, we have the highest rate in the world, which sits at 1 in 1,400 people. And yet the community have been segregated for many years. And this has happened mainly because the genetics behind albinism have been misunderstood at times. Part of my journey in coming into this work was a book called Takadini, which had a protagonist with albinism. Reading this in grade school was my first time and first window in understanding the life of someone with albinism. And so then I sought out ways to get involved and I started volunteering with the community through NGOs. And over the past 10 years, I built a lot of relationships with people with albinism. Then during the pandemic, I was doing my undergraduate degree in Canada and closely watching how public health was responding to the pandemic in different countries. I was curious to see how Tanzania was responding to vaccines and who would be listed as a priority population. I realized that most often prioritized populations were those who were older and those who had immunosuppression, which many of people with albinism have. And yet, people with albinism were not listed as one of the groups to be prioritized for vaccination. In Tanzania and in most parts of the African continent, the life expectancy of a person with albinism is up to the age of 40. So vaccines are very critical for their well-being and to prevent excess morbidity and mortality. So I started to think back to that and then think back about my degree in epidemiology, where I would be training in infectious diseases. And so those two kind of came together as I got to Stanford and started my graduate degree. I started thinking about research studies that would make sure that I'm able to go home and work with communities that I've built relationships with, but also ensure that they drive what the question is. So my mentors and I worked with communities with albinism to develop a research study, and we adapted the WHO's standardized measure for vaccine hesitancy to understand equity barriers that were being faced by this population. We had help from Dr. Heidi Larson, who is an expert in developing measures to understand vaccine hesitancy as a concept. And on top of that, we conducted interviews with those who had expressed some form of hesitation to get vaccinated. And we wanted to understand whether it was about access or inclusion in terms of how the vaccination campaigns were being run. And through the study, we confirmed that people with albinism had a lower rate of vaccinations for both COVID-19 and for childhood vaccines, even if the vaccines were made available to them. A lot of them cited numerous equity barriers, and so we hope that our findings will inform future policy around the prioritization of people with albinism in healthcare. Beyond this, we worked with the community with albinism to find meaningful ways to translate the results to support their goals and priorities. And for them, a lot of that came from mixed arts and media. Through the study, we realized that their priority was actually just normalizing albinism, and that was really important because vaccination hesitancy came from structural barriers related to stigma rather than misinformation. And so then, because of that, we created a rap song that spoke about albinism and normalized its experience.
Walibagua hingozi, nikachagua kuwa kiongozi, nikawaelimisha na kuwakilisha, nikawafuta machozi. Now don't be afraid to hold my hand. We are one family, a clan. I know I will, I must, I can. I'm walking with freedom on my land.
The project was possible because of my mentor, Dr. Steve Luby, believing in me. And so when I went back to Tanzania and started forming my own team, I wanted to pay it forward and be a mentor myself for high school students in Tanzania. So this was their first exposure to STEM research, and it was really important in having a conversation of what kind of research careers are possible and what kind of opportunities that they could seek out. And it also drove home the message that, as we study and move forward, how do we bring back that conversation to communities that raised us? And so being able to have them involved and being able to see their excitement, being part of this research brought a lot of peace for me, knowing that they're also from communities where data has been denied historically, and ensuring that they are now part of the conversation, not just part of it, but also they're able to lead that conversation. So I think it's an important obligation that we have, being in this space at Stanford, but also being people who work in global health and epidemiology, knowing that the data we collect is more than just a number. It has meaning. It's someone's community and it's someone's neighborhood.
I feel stronger than before. I'm opening the door now. I feel the sunlight. No one's stopping me, no. I'm walking this road. Nothing bad, kwa kufurai. Cause we all smile. Now you're too high. We alright. Cause we all smile. Now you're too high. And we alright. I am beautiful. I'm more than enough. My life is beautiful.